be prepared about the third wave, and what's happening with the children? Like, is this COVID really entering the children's, and how serious it is, and how well we should be prepared on that?
This is Dr. R.K Singhal this side. I'm an M.D Medicine and Diabetologist currently practicing in Madhya Pradesh, Bhopal. So at the era of this COVID-19, so we are getting too many news about the third wave that will affect too many children. We are already facing too much damages from the second wave also. Another monsters is in front of us that is about to come. That is a third wave of COVID-19 infection. So one thing we should be very clear in our mind that the virus has never been eliminated from our environment. Population, which is now is not in the reach of COVID-19 is mainly the childrens who even not vaccinated, and we don't have any effective vaccine for the less than 12 years of children also. Yeah. So this is the target population for the next third wave of the COVID-19 infection. So what we have to do, we have to prepare for this, and we need to keep them safe from these infections. So what can we do for this wave? That keep the social distancing, wear a mask over their nose, do not go out unnecessarily. Children's body is little bit different from the elderly persons. The elderly are those who's in the senescence phase. Our organ functions are already had started in declining phase. In the children, the just opposite has happened. The body is building, the organs are developing, the immune system is getting ready for the newer infections. Severity might not be that much severe in children as severe as in elderly patients, but we need to keep them safe. We don't know we can't predict the severity in all the children at the same time because everybody is different. So many children who have some congenital anomalies, who have some genetic problems, who are taking medications, we don't want to expose them with the viruses. Okay. Right? Yeah. So third wave, yes, it can come anytime. So we are predicting it in October or November. We prepare for that. Keep distance from the others, as well as we consider the Indians are too much social compared to foreign countries. So we need to limit that socialization. Once we maintain the distance, once we maintain it, the virus will started going out from our environments. Though then we can think that now, okay, we are a little bit safer place or in the safer situation. Yeah, when we come to about plasma therapy is something, first we need to know what is plasma. Plasma is something, a component of our blood which has all the antibodies which our body is producing. So in the first way, we see that there is a first attack of COVID-19 infections. The virus is new. It is new to our body, so our body detects this virus and starts synthesizing antibodies against it. So in the first wave, once a person is infected with COVID-19 infection, their body will generate antibodies to them. So now in the future infection or reinfection, the severity will be very less as we already have antibodies against the virus. So in the first wave, it is very effective. Yeah, the virus is new. The strain which came to us is only one strain which we are facing. So body know that this virus might get infected you. So antibody can fight with them and can efficiently and effectively handle it. But now in the second wave, or as we predict in third wave, the situation is little different from the first wave. As we know that the virus already had 2 or 3 mutant strains. It came to know that our body is fighting with him, and we have prepared something which can stop him to spreading. So the virus has changed himself, and now the newer and newer strains are coming in the environment. So our body is not familiar to that particular newer strains. So we don't have antibodies towards the newer strains. So now in this context, when we have many different strains in the environment, so plasma therapy will not be that much effective. Infected with a COVID-19 virus, and when other person is infected, the strain is different. So both antibodies will not be same. So one antibody will not protect him from the same infections. Okay. So in this era or in the future era, the plasma therapy is going out from the treatment part as we consider treatment part of COVID-19 infection.
So yes, as per your suggestions, the only way we can be safe is by maintaining the social distancing and having like masks all the time if we are like gathering with people, and avoid unnecessary going out. That's the only
Going
option
up,
we
right?
have, and we need to be prepared for the third wave. That's